Are you confident when writing to another healthcare professional in the OET writing? Watch this video where I explain how to select relevant information for your reader. Hello, I'm Jo from Specialist Language Courses. We are OET premium preparation providers, which means you are in the right place. Don't forget to subscribe to our YouTube channel, hit that bell so you know every time we post a new video. Let's go! In the OET writing test, you might need to write to another healthcare professional, such as an occupational therapist or a physiotherapist. Let's take a referral to a physiotherapist as an example. What information would be relevant in a letter to a physiotherapist? You might need to include brief details of perhaps an accident or an operation, the reason why the physiotherapy is needed, information related to mobility or range of motion, occupational therapy interventions, and any information related to physiotherapy sessions given or needed. Look at this task. You are the charge nurse at Shippington Community Hospital where Mr. Jones was admitted on the 21st of February after a fall. Using the information in the case notes, write a letter to the community physiotherapist, Mr. Tim Jenkins, requesting physiotherapy home visits for Mr. Jones. We are writing to the community physiotherapist who will visit Mr. Jones at home for physiotherapy. So what information would you choose to include? Take a look at these notes and decide. The patient's name and age is relevant and, of course, what happened. However, the social background of the patient does not relate to the care the reader will provide, physiotherapy, and so should not be included. The past medical history is also not relevant to the reader or even this particular medical issue. What about hospital treatment? Information about the pain on admission and the X-ray are no longer relevant. This happened before the operation and does not relate to the reader's role in this case. But details of the surgery is relevant. Information about medication and wound monitoring is not relevant. This is not something a physiotherapist would be involved in or need to know about. Details of all the hospital physiotherapy sessions are not essential. The earlier sessions are no longer relevant, but the most recent range of motion is relevant. Similarly, a history of the patient's mobility during recovery is not needed, but his current mobility is. Now let's look at the discharge plan. What information would be relevant to include for a physiotherapist? The most important information and the action you need the reader to carry out is the physiotherapy sessions. So any details of this are essential. Since more physiotherapy might be required after the surgeon's review, the date of this appointment is also relevant. Although this is not being performed by the reader, but by the occupational therapist, it is useful information for them to know, as it relates to mobility, so should be included. However, the monitoring of medication is not something the physiotherapist would be involved in. Therefore, it is not relevant. So my top tips for selecting information for another healthcare professional. Look at the task at the bottom of the case notes to find out who you're writing to and why. Really think about what they need to know, and when deciding what to include, ask yourself, is this something they would be involved in? So if we're writing to a physiotherapist, we don't include details about medication because it's not something they're involved in. What other healthcare professionals are not involved with medication? Let me know in the comments below. And if you like this video, like and share with your friends and colleagues so we can help more people pass the OET exam. Don't forget to check out our website. We've got the perfect preparation course for you. See you next time. Bye! Watch this video because I'm going to show you an easy way. So let's look at something. Woohoo!